Hi guys, this is Dr. Jonas Apostol. So I'm here again to share with you another case. A very interesting one because we are looking at the health of the teeth here. The two front teeth were compromised and we have to do something about it. But then the patient also wanted a beautiful smile. So we have to plan things out. We have to prioritize the important matters. Of course, when doing restoration, we have to make sure that it is healthy. So health is number one, the number one priority, and function would be the second, and the icing on the cake would be the aesthetics. But don't get me wrong. So these three ideas is like a trinity. So we have to incorporate one from one idea to another. And we have to make sure that it is well implemented. It should be healthy, it should be functional, it should be beautiful. So that is our case for today. As I have always mentioned that it is very important to make sure that the teeth are healthy, the gums healthy, and you can eat and you can smile. And that's really the essence of an apostolified smile. So this patient went to my clinic with a chief complaint of having this not so beautiful smile. And also she has problems with the two front teeth, which appears to be bulky, protruded, as well as the color is a little bit off. Texture-wise, there's a little bit of problems. Before we implemented any treatment plan, we made an assessment. Clinical assessment is very important in every dental procedure. Of course, we have to make sure that everything are well assessed clinically and also radiographically. So after collating everything, the pictures, dentofacial analysis and everything, we of course found out that there's something wrong with the health. And that is the most important thing that we have to deal with. So usually when we consider that, we have to check the distal extent of the teeth whenever she smiles. So we have to check that last teeth that's obvious so that we can decide how many units we're going to do in order for us to create that more balanced and more symmetrical smile. So there's mild occlusal contacts, a little bit of parafunction. That's why I extended it to second premolars to make sure that we remove those parafunctional contacts. So after a thorough discussion with the patient and after enlightenment and everything, because this is a commitment, whenever you have your teeth done, even if it's a crown, bridge, veneers, you have to consider that these types of treatments are irreversible. So once you have veneers, crowns, and bridges, you will have that. It's not going to be easy to remove, and it is a commitment on your part as well. So our goal is to make a healthy as possible, not just on the teeth, but also on the gums, functional as possible, and at the same time, it's beautiful as possible. So we do have as possible because we do have limitations. No, we cannot give you like super perfect sets of teeth because there are limitations in everything. A lot, material, type of case, type of faces, and we do have like our own way of doing it in my clinic. I mean, we don't have any templates here. I don't have like a template that I copy. I always look at the face of the patient in relation to the teeth, or the teeth in relation to the face. The other way around. I need to make sure that what we do is a good one, that is beautiful to wear, because you're gonna be wearing it for the rest of your lives. Although with exemption, sometimes you have to change it. No? Did you know that the veneers can last decades? A decade, 1 decade, 2 decades, 3. There's a study that it lasted 40 years. But it really depends on how you take care of it. There are some problems also associated. Let's say, for example, you do have bad oral habits, like you do nail biting, you eat hard food, whatever, or any habits in the mouth can actually lead to failure of any restorations, be it zirconia, be it porcelain or composites. And also parafunctional contacts, like anything that's not appropriate contact, so it could lead to something, a failure also. Most common is the night grinding. It will go down to 60% chance of failure if you do grind your teeth. So we do have a way in order for us to combat this type of problems. So after the removal of the old restoration, we found out that there's a compromised sound structure of the whole tooth structure of tooth number 1-1 and another tooth number 2-1. So we have to make sure that we establish it first. We have to make sure that we are using a stable tooth. Or do we need to do more in order for us to stabilize a tooth for it to be used as a sound abutment for the restoration? Or do we need to fuse it? So there are a lot of questions, you know, when we're doing our strategy, when we're doing our treatment planning. Basically, sometimes we cannot like formulate it as easy as 1, 2, 3, and sometimes it requires more. It requires a lot from us, studying the case outside the mouth, studying the case radiographically, studying the case after removal of the old one. So after we have removed the old crowns, there's a huge problem because of the extension of the cavities. There's as well discoloration of the teeth because it's non-vital for a long period of time. It's another problem when you do your restoration because sometimes it's really difficult to conceal and to mask this kind of discoloration, especially on the front teeth, especially with this kind of extensive staining. So of course, we did the right thing. Number 1, we cleaned everything, removed all problems, removed all cavities, caries using caries detector dye. I did the bio-base on this one. We made sure that everything's properly treated, disinfected, and made sure that there's no bacteria inside the canal, inside the teeth, in order for us to finalize the bio-base. With the bio-base, we are stabilizing the tooth to be used as abutment. It is one of the most effective scientific treatment option for this type of case in order for us to come up with a beautiful and restoration that can last. We do prepared the other teeth from second premolars to second premolars on the upper arch. So it's a combination of crowns, veneers, and onlays. So let's jump to the material used in this process. So I chose porcelain fused to zirconium oxide. I used the zirconium oxide as the base and we layered it with a porcelain to be able to create a lifelike restoration. And the patient requested a little bit wider, subtle white teeth, also with a little bit of translucency characterization. So she doesn't like the idea of having a super crazy white teeth because she believed that natural restoration would suit her face. We made sure that it suits her well. So this is a zirconium oxide layered with porcelain. So try-in of the ceramic is very important before we place it in permanently. Of course, we have to judge it first and modify if possible, if there's any problems. Number 1 is that we need to check the fit. If the fit is problematic, then we have to make sure that we get rid of that problem because it might compromise the sound structure of the teeth. And then after, we check the design. Okay, so after we check the design, we ask the patient to take the photo in order for us to check if she likes it or we want it for her. So after that try-in, the patient loved it. We decided to cement it. So based on every steps, the checklist, like the fit, the design, the color, texture, the distribution, symmetry, all of these steps, checklist, we were able to get a nod, and the patient was happy as well. So we cemented it permanently. So here's the result. As you can see here, we have solved the problem. We have made a stunning result. A well-distributed smile as well as perfectly fit veneers and crowns to be able to avoid problems such as proliferation of bacteria. And also the problems with discoloration of the two front teeth were addressed. And most of all, it is functional. So we have achieved the healthy way of restoring the teeth plus enhance the functionality as well as the beauty. As you can see kanina, parang may composite that was parang tinapal dun sa facial of tooth number 1-1. Napapasukan kasi ng bacteria yon. So, ang ginawa natin, we removed everything, we clean everything, we disinfect everything, and then we made sure that we have a margin and we closed it with the ceramics plus with our cement. So yung cement na yon, yung mga junction niya sa margin, yun yung kino-close ng cement in order for us to bond it perfectly, in order for us to close all those tiny spaces. Yun yung ginawa natin para hindi siya mapasukan the next time, para mas tumagal yung ngipin. So the patient were so happy about the result, and I am so happy as well. At the end of the day, whatever we do here in our clinic, we do it with all our heart and with all our dedication and passion. And I believe also that an excellent treatment is never an accident, but it is a careful implementation of the techniques and methods in order for us to create a successful, beautiful smile. So, a very challenging case, but always a pleasure in helping these patients despite of all the challenges, by giving our all, by providing what's the best for the patient, and that's what we always do here at Apostol. So I hope you enjoyed the vlog and see you again next time. Bye!